There are diseases that, due to their latent nature, can develop without obvious symptoms until they cause significant harm to the body. These conditions often remain invisible at the initial stages. What makes them so dangerous? It is important to know about them in order to recognize early signs and take timely measures. One of the most common is chronic kidney disease. This condition impairs the kidney's ability to filter toxins from the blood. Although the disease can remain asymptomatic for a long time, it can lead to kidney failure if it is not detected in time. The risk factors include high blood pressure and diabetes. In later stages, symptoms such as fatigue, swelling, and changes in urination may occur. Early diagnosis is essential to prevent complications. Another disease that often goes unnoticed is hypertension, known as the silent killer. And many people experience no obvious symptoms, but the condition can cause serious damage to the heart, kidneys, and the brain. If left untreated, hypertension can lead to heart attacks, strokes, and heart failure. So, regular blood pressure measurement is especially important for people with a hereditary predisposition as well as for those who are obese or who lead a sedentary lifestyle. Among the silent diseases that mainly affect women, ovarian cancer stands out. This dangerous disease is often diagnosed at a late stage as its symptoms such as bloating, stomach discomfort, and chronic fatigue are easily confused with less serious problems. So, regular screenings are especially important for women with a family history of cancer. Another hidden thread is type 2 diabetes, which affects millions of people. This disorder is associated with the body's inability to use insulin effectively, resulting in high blood sugar levels. In the initial stages, many patients are pronounced absent or no symptoms, and they do not suspect that destructive processes are occurring in their body. Without treatment, diabetes can cause serious complications, including vision loss, amputations, and kidney failure. Diabetes prevention includes a balanced diet, regular exercise, and medical examinations to monitor blood sugar levels. A serious threat to the liver is fatty liver disease, also known as steatosis. This condition can progress to inflammation and cirrhosis without any obvious initial symptoms. It is linked to obesity, diabetes, and high cholesterol. If left untreated, it can lead to irreversible liver damage. Prevention includes maintaining a healthy lifestyle with an emphasis on proper nutrition and regular exercise. Liver problems are often underestimated because their first symptoms, such as mild discomfort in the right hypochondrium, seem insignificant. Pancreatic cancer is another of the most dangerous diseases characterized by high mortality due to late diagnosis. In the early stages, there are usually no symptoms, but when symptoms appear, such as yellowing of the skin, abdominal pain, and weight loss, the disease is usually already in an advanced stage. This highlights the importance of paying attention to any persistent symptoms and undergoing regular checkups, especially if there is a family history of such problems. What nutrition scientists say eating a healthy diet high in fiber and antioxidants may help reduce the risk of developing the disease. Polycystic ovary syndrome, although not always perceived as a serious condition, can have high significant consequences if left untreated. This syndrome is associated with hormonal imbalances that can cause infertility, type 2 diabetes, and cardiovascular disease. Many women don't realize that they suffer from this syndrome as its symptoms such as irregular menstruation, weight gain, and acne are often attributed to other causes. Early diagnosis of this disease raise awareness and provide necessary information to prevent complications. Cerebral aneurysms also pose a serious threat. These are pathological expansions cerebral vessels which may rupture, causing potential fatal hemorrhage. Most aneurysms do not cause symptoms until they rupture, making them especially dangerous. Risk factors include high blood pressure, smoking, and hereditary. Regular medical checkups can play a key role in their early detection of it. Also, diagnostic methods such as MRI and CT scans are becoming more accessible, which allows us to detect pathology even before serious consequences appears. Osteoporosis is another disease that develops silently, weakening the bones until a fracture occurs. This disease is more common in postmenopausal women but also affects men. The first signs often appear as fractures of the hip, spine, or wrist. Osteoporosis can be prevented through a calcium rich diet, regular physical activity, and medical supervision. Modern treatment methods include taking medications that strengthen bone tissue, which is especially important for older people. Lyme disease is another one that is transmitted through bites of infected ticks. It can also lead to serious consequences if it is not treated in time. Initial symptoms such as fever, fatigue, and the characteristic rash often go unnoticed. Without treatment, the disease can become chronic arthritis, heart problems, and neurological disorders. Protection from tick bites and timely visit to a doctor if you suspect an infection are important preventative measures. It is important to remember to promptly remove ticks and treat the bite area to actually reduce the risk of infection to the area. Another disease that deserves attention is high cholesterol. Often it shows no sign until a serious event occurs, such as heart attack or stroke. High cholesterol can damage blood vessels over the years, forming plaques that impede blood flow. The condition can be controlled through changes in diet, physical activity, and, if necessary, medications. Modern research shows that taking statins can significantly reduce the risk. Low content diets, saturated fat, and regular sleep will help. Sleep apnea is another hidden disorder that affects breathing during sleep. Many people are unaware of the presence of this problem, but it can lead to complications such as hypertension, heart disease, and strokes. Loud snoring and constant fatigue during the day are possible signs of apnea. Specialized tests help diagnose and effectively to treat this condition. Now, it is important to know the danger of such disease is not only in their severity, but also in the fact that they can develop without actually any symptoms. Therefore, prevention and early diagnosis actually play a key role in detecting it. So, maintaining a healthy lifestyle, getting regular medical checkups, and paying attention to your family medical history can be important steps to prevent late diagnosis. Symptoms such as extreme fatigue, unexplained weight loss, or persistent pain should not be ignored as they may be signs of the disease. Being informed and taking care of yourself are our best tools in the fight against these hidden threats. Thank you so much for watching, and please remember to subscribe to the channel, turn on your notification bell, give this video a thumbs up by pressing that like button. When you do that, it helps out the channel a lot. And thank you so much for watching. Take good care.